At the time of making this video, a quarter of the world's population is now living under some kind of lockdown as a result of the COVID-19 pandemic. Many of us have been told to stay at home and only leave the house for essential activities. The modern world as we know it has almost come to a complete stop. The global economy is struggling to function, with bustling inner city traffic ceasing across the globe, the commercial airline passenger industry disappearing almost overnight, and non-essential industrial zones having to shut up shop. Many of us have been asking, well, what does this mean for air pollution? Surely one silver lining of all this is that such a sharp decline in all of these polluting activities has temporarily cleaned our air. Some scientists are calling this period of time the largest scale experiment ever to see if we can drastically cut levels of air pollution. So far, there seems to be evidence in support of this, with data revealing remarkable declines in pollution levels around the world. Take China, for example. This is a snapshot of the levels of nitrogen dioxide pollution over a 6-week period between February and March 2019. And this is the level of nitrogen dioxide from the same period in 2020, when China imposed some strict lockdown measures. Massive improvements in air quality have also been observed in India, a country which has hosted 21 of the world's 30 most polluted cities. For example, in the capital New Delhi, harmful levels of microscopic particulate matter, known as PM 2.5, fell by 71% in just the space of 1 week. In Europe, we see a similar story. In the UK, road traffic accounts for 80% of nitrogen dioxide levels, which could explain why we have seen such a drastic drop in levels of pollution there. And in northern Italy, NO2 levels have fallen by about 40%, which could be due to the lack of activity in its industrial heartland. So, what does this all mean for human health? According to an analysis by Stanford University professor Marshall Burke, an estimated 77,000 lives have been saved in China just as a result of the reduced pollution levels since the lockdown. Microscopic polluting particles have the ability to slip past our body's defences and penetrate our respiratory and circulatory systems, causing damage to our lungs, heart and brains. As such, air pollution is one of the world's leading causes of death and disease, with the World Health Organization estimating that roughly 4.2 million premature deaths are a result of outdoor air pollution, with 1/3 of deaths from stroke, lung cancer and heart disease being attributable to air pollution. This is having an equivalent damaging effect on public health to that of smoking tobacco, and a much higher effect of consuming too much salt. But what does all this really mean? Public health experts have warned us against using this drop in air pollution to make some kind of cost-benefit analysis around pandemics. We should not use this data as a reason to diminish the suffering the situation is causing worldwide. However, these unprecedented circumstances do give us an opportunity to shed some light on the harmful environmental and public health consequences of the status quo. Air pollution, in contrast to a viral pandemic, is a long-term health threat, meaning it doesn't get the political attention it requires to be addressed adequately. With public health now at the forefront of our minds, perhaps we can use the data generated by this worldwide quarantine as motivation not to return to the same harmful practices that existed before the pandemic, and instead invest into technology and adopt policies which could help clean our air and save lives.